So the next presenter is Brandon Van Soest, and he's going to present on the effects of transition milk on growth, health, and gastrointestinal development in calves. And this is work that he conducted at Michigan State University.
Thank you for that introduction, Dr. Borman. As you can see, my email is at the bottom of the screen, and I'll have it at the end as well for any questions. So, as most of you guys know, separation of the calf from the dam at birth is normal practice in the industry today, which makes the calf become farmer reliant, and also comes with stressors throughout early life. Some of these are from separation, transportation, diet, dehorning, human interaction, environments, both weather and where they're located, disease, and I'm sure you guys could list off for days all of the other ones. So this causes immunocompromisation, as you can see from the depiction on the right. Total immunity on the y-axis stays on the x-axis. Colostrum intake increases that passive immunity early in life, and then drastically decreases there at the end of the first week, beginning of the second week, leaving that area of susceptibility for calves before their active immunity comes into play, which we need to minimize as we manage our calves. So with this, transition milk has been shown in many studies, or in a few studies here, as we increase the feedings of transition milk to decrease health scores, which is as shown earlier today, an improvement. As you can see, nasal scores, eye and ear scores were decreased in Cornelius studies, and the ones below improved feces as well. Most of you guys know, and pretty much everybody in the dairy industry knows, that colostrum has a benefit at the level of the gut, or at the level of the gut as well as in the immune system. So I'm just going to point out that the gut, we see that there's a improvement in gut development and function with many different studies here. And just for sake of time, jump down to the bottom where we talk about the increased concentration of growth factors, hormones, and bioactive components with a potential localized effect with binding in the gut, and also having reduced apoptosis rate in the epithelium as well. So with this, I wanted to show colostrum, transition milk, and whole milk's composition with definitions of colostrum being milkings 1, transition milk being milkings 2 through 5, and whole milk or milk being milking 6. And you can see the nutritional components there as they're shifting, but I want to specifically point out the bioactive components, just 4 of them here, which there's many of them in milk, just immunoglobulins, IgG, IGF-1, and insulin, and seeing that there is still a large quantity of these in measurable amounts in transition milk as well. With this, we thought looking into transition milk and seeing if it has an effect, we hypothesized that transition milk would stimulate the intestinal development while improving health, increasing body weight gain, and also compared to that with milk replacer, which is standard fed most farms. So to test this, we looked at we purchased 23 calves with 11 calves being on transition milk and 12 being on milk replacer from a commercial farm, and fed it diets for 3 times a day for 4 days. Transition milk was collected and pooled by milking, so milkings 2, 3, and 4 were kept separately and fed back out as shown on feedings 2 through 5, 6 through 8, and 9 through 12. And milk replacer was consistent through all 11 feedings following colostrum. Just to show you a weekly timeline, we purchased 4 calves a week for 6 weeks to get to our number. Calves were born within an 8-hour window on day 1, where they got fed 2.8 liters of colostrum within 20 minutes of birth, and they arrived at MSU midday. Calves were fed again at 4, 11:30, and 6 p.m. And we measured body weight, took blood samples, and took measurements on days 1, 2, 3, and 5, with day 5 being the last day of the study. Calves received an injection of BRDU to measure or to mark cell proliferation before they were euthanized and tissues were collected. So to get to some of the results, as you can see on day 5, body weight gains, we saw a 1.6 kilogram increase body weight for transition milk calves compared to milk replacer, and you can see the average daily gain basis there. We also saw a tendency to increase heart girth and hip height, with no difference seen in wither height between our treatments. When we looked at serum measurements, we looked at IgGs and total protein. We saw an increase in both for transition milk calves, as you can see with the black line, with the solid black line with the squares in both of these, with transition milk calves no longer seeing a difference on day 5 for IgGs, but continually being elevated on day 5 for serum total proteins. Again, as mentioned before, health scores, 0 is healthy and 3 is more severely ill, and then the gradient goes in between from 0 to 3. And our health scores, we saw a decrease, which is an improvement of cough, fecal, nose, and ears with our transition milk calves compared to milk replacer calves over our treatment when looked at each feeding, so being scored 3 times a day by our researchers. So looking at our tissue measurements, I did not include all this for sake of time, but I wanted to look at the duodenum and proximal jejunum, as they both, or all 4 sections that we looked at, the mid-jejunum and ileum as well that I left out, follow suit with these results. As you can see, the villus length, villus width, the VC is the villus length to crypt depth ratio. Mucosal thickness and submucosal thickness measurements were all significantly increased for transition milk calves compared to milk replacer, with no difference seen at the crypt depth. Proximal jejunum again followed suit, as well as the rest of them, as I mentioned. But I just wanted to point out, as this proximal jejunum was the section that increased the most. As you can see, 96%, 102%, and 98% increase in those sections respectively. And then to look at cell proliferation, where we used BRDU to mark the cells. This is just 2 examples again. This is the mid-jejunum and proximal jejunum, leaving out the duodenum and ileum in these pictures. But when we looked at the cells per millimeter squared, or the area within the cell, or the cryptute and villi section called the lamina propria, we saw an increase in cell proliferation for all 4 sections. And we put this on a cells per millimeter of the epithelium. We also saw that increase in cell division and proliferation in our development of the intestines for transition milk calves. So in summary, we saw that feeding transition milk to our calves increased growth, increased intestinal development of the villus, mucosal, submucosal, villus to crypt ratio, and cell proliferation, as well as improved indicators of health in our calves. For full results, I had to leave out, you can see that at ADSA, or you could also email me if you had any specific questions about these ones. And again, there's my email if you'd like to shoot me any questions. I'll try to be in the chat room again this evening, as well as answer them later on. So thank you.
Thank you very much, Brandon. And it is hard to condense your research that you worked on for years into 7 minutes. So we appreciate all the grad students doing that.